It seems as if 24 hours is a long time when it comes to COVID-19. So much has developed in terms of where the vaccine's up to and what COVID's strains have dished up in the Northern Hemisphere. Associate Professor Sanjaya Senanayake from the ANU joins us right now. Sanjaya, welcome.
Hi, Chris. How are you?
I'm very, very well. Those numbers out of the UK, a record number of deaths overnight, and then I think the infection rate is now up to 1 in 10. When does this nightmare end? I know they're getting the vaccine, but nothing seems to be budging.
Yeah, no, it's a very sad situation in the UK. I think 1,600 deaths in the past 24-hour period. The problem is that the infection has such momentum at the moment, it will take a lot to bring it back. So they've gone to that tier 4 level of lockdown, so that will have an impact. But we know from previous lockdowns in other countries that can take a few weeks. And of course, they've started vaccinating. But again, until you've vaccinated a large enough part of the population, you won't necessarily see an impact from that.
Now, we're also hearing some reports overnight of a third UK strain, not the UK strain that is 70% more contagious, but one that's another 30% more contagious. There was one description of it as an horrific beast. What do you know?
Yeah, look, there are a few strains that are circulating that have emerged. I mean, you talked about the UK strain, which we call B117. There's the South African strain that has spread to a number of countries. Also, the UK has seen a strain called P1 come from Brazil, which has also gone to Japan. And these strains are supposedly more infectious because they've got changes on the spike protein, and the spike protein is the bit of the virus that interacts with human cells. So if there are mutations, potentially the virus is learning how to engage our cells more easily and get in. But it really is hard to say when there's so much infection about in the UK if a particular strain is more infectious. For example, the UK strain, you talked about the 70% more infectious. They did some analysis and found, compared to the non-UK strains that they were seeing, it would only, if 100 people were infected with COVID, those with the UK strain would only infect 5 more people on average. So 15 people versus 10. So it is more infectious, but not necessarily that much more. But the issues in the UK, they're having the large numbers of infection may be responsible for what we're seeing.
Now, the international travel industry is talking today about having passports. So we'd have a medical passport, no vax, no fly. And I can understand why they would do that. But if we're being told that having this vaccination still means that we could get the virus and we could still pass it on, is that going to make much of a difference?
Yeah, no, that's a very good point, Chris. So these vaccine studies, these phase 3 trials we've heard about, they've been designed to look at how successful or efficacious these vaccines are at stopping you from getting sick with COVID. They haven't specifically looked at whether they will stop us from transmitting COVID to someone else.
Right.
There's been some data from the AstraZeneca trial and from an earlier phase in Moderna, but we don't really know. And you're right. If people have got vaccine passports saying, I've had the vaccine, but they can still carry COVID asymptomatically and transmit it to someone, it doesn't help.
Now, tell us about the Novavax vaccine, which is being created in Australia. There is some feeling that this could emerge as one of the predominant and preeminent vaccines. What do you know about it?
Yeah, so Novavax, it's an older style vaccine, so a protein subunit vaccine, a bit like the University of Queensland vaccine. They use some nanotechnology in it, I believe, and they've seen a couple of encouraging results from earlier trials. In animal trials, they found that they could stop infection itself. So you were talking about whether these vaccines will stop transmission, even if you're not sick. Well, in the animal trials, it seemed to do so. And also the antibody levels they seemed to generate in early human trials were really good. In fact, sometimes higher than those seen in humans who'd actually had COVID. But while all that's promising, the reason we have phase 3 trials, Chris, is because we know that the promising results you see in preclinical phase 1 and phase 2 trials, don't always appear again in the phase 3 trials.
Okay.